welcome back to Janine's Journey. You guys, I love filming out here. It's just such a beautiful, peaceful day, and with the beautiful sunlight, I was like, let me just record outside. And it's something that I rarely ever do, actually, is recording outside. It's I'm always inside or just inside. Anyway, so as you can tell by this title, I am finally coming to you guys with my nurse practitioner update video. And that is because it has been weighing on my mind and my heart really heavy lately. And as always, you guys know I have my handy dandy notebook here. I have been writing down my thoughts and my feelings, and I just been writing down the emotions and everything that I've been feeling for the last 10 months that I've been a nurse practitioner now. Yeah, because I got my certification and my license officially in February of this year. So it is now December, and it's now time for this long awaited update. I've been wanting to do this update since August. I'm outside, you guys, so disregard any nature sounds that you do hear. I've wanted to do this back in August, but as you guys know, I recently just started a new position as a primary care nurse practitioner, and I have up until September been practicing as an urgent care nurse practitioner, which is still considered primary care, but I am now officially in a pediatrician's office practicing full-time as a primary care pediatric nurse practitioner. Ooh, a mouthful. So let's just get into this video. Some of the questions that I will be answering is, do I like it? What's next? Do I miss being a registered nurse? And do I feel like I'm truly making a difference in the outpatient primary care setting as a nurse practitioner? So let's just get into this video. Let's get with it, and thank you guys for clicking on yet another Vlogmas video. Make sure you go ahead and subscribe while we're sitting here talking about Vlogmas. I am really excited, and I hope you're enjoying the content that you're getting thus far. I don't know which day of Vlogmas this is because I am doing a lot of pre-filming for you guys because I am working 5 days as a nurse practitioner now. But I promised that I was going to do Vlogmas to myself and to you guys, but really it's something that I truly like to participate in. I just didn't know how, I'm not going to say difficult, but how cumbersome it has been because I am working full-time. Sorry, I got distracted by a phone call, and I'm recording on my phone, by the way, because I forgot my camera at home. But anyway, do I like being a nurse practitioner? And the short answer is yes. I do enjoy being a primary care provider, or I do enjoy being a nurse practitioner due to the autonomy that I have. I don't have anybody just over my shoulder and, you know, up my grill all the time. I literally have my set number of patients on my schedule, and I come in and I see those patients and I go home. I decide what needs to be done. I decide how I'm going to proceed with the patient. It is all my decision, me and the parent's decision, of course, or patient if you are a an adult practitioner, or even with my older patients, we decide on a plan of care together. But it's something that we come up with, and I don't have to get an order from a physician or an order from an advanced provider if I was just practicing as an RN. So short answer, yes, I do like it. Do I miss being an RN? Short answer, yes, I do. While I do enjoy being a nurse practitioner, I do miss being at the bedside. I miss my friends, and I miss acute care setting. I should say I really do miss being in an acute care setting because the primary care setting is very, very different. So short answer, yes, I do miss being a registered nurse. One of the points that I did want to discuss is being a pediatric primary care provider. I'm not going to say it's very difficult, but it definitely has its difficult moments. I have been honestly overwhelmed, and I'm trying to cry about it because it's really just been something that's been weighing on my spirit lately, and it is becoming overwhelming. I have to sometimes bring home charts, dealing with the different parent and the different potential diagnoses that I may have to see. So with me being a primary care provider, anything could come in, any complaint that the parent may have. You just never know what you're going to see. And one of those things being potential tumors. In my short 10 months of being a nurse practitioner, and even my short while of being at this office that I'm at, I found a tumor in one of my patients, and turns out that it was cancerous, and that itself was difficult. Having to relay that information to the mom was difficult. Talking to the mom once I did get finding out that my patient had a Wilms tumor was very nerve-wracking, because in school they teach you, oh, Wilms tumor, it can 90% survivable, most times it's eradicated, and it's a blip on the child's history. And when I'm talking to that parent, they can't hear anything else besides your child has a tumor in their kidneys. A Wilms tumor is a tumor that's found in the kidneys, and sometimes it can be palpable in the abdominal cavity and in the abdominal area. I honestly thought when I felt it that it was what you call hepatomegaly, meaning your liver is enlarged. And even if her liver was enlarged, we were figuring out why it was enlarged. Was it due to a viral reason? Was it due to bacteria reasons? Was it due to an infectious reason? Not thinking that, oh, I found a tumor in my patient. And so that was very, very difficult with having to relay that piece of information to the parent. And I just felt overwhelmed, because not only did I had to relay this information to the parent, I have had no guidance in how to deliver bad news to a patient or deliver tough and difficult news to a patient, because in the acute care setting, I obviously relied on the providers, the doctors, the physicians to, if I saw something on an x-ray, or if I saw something on an ultrasound, I would, tell the parents, we'll just have to wait for the doctor, because I can't give that information as a registered nurse. But as the primary care provider, it was my responsibility to tell this mom this information. And so I wasn't prepared for it. They don't prepare you for it in school. And on top of that, I still had a busy, full schedule of patients that I had to see in the midst of having to tell this mom this. And I didn't want to wait until later that evening, and I think it might have been even a Monday night where it's my late night. So I didn't want to wait until after I was finished seeing patients at 8 p.m. That was definitely overwhelming. Being a primary care provider is overwhelming, and I want to give you guys the nitty-gritty, the truth behind being a provider, because that's what I've always wanted to relay here on Janine's Journey. Is while I do love what I do, it can be very difficult at times. And am I second guessing my decision to become a nurse practitioner? Maybe a little bit. Not really, because it's something that I've always wanted to do. So I don't care what information anyone would have previously given me, I still would have wanted to be a primary care provider. I've had lots of nurse practitioners tell you, this is not what you want to do, you shouldn't do it, blah, 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 blah. But you don't know until you figure that out for yourself. And there are other things to do in this big, wide realm of being in the medical field, especially being a nurse practitioner. If primary care doesn't work out for me, then it doesn't work out for me. The urgent care doesn't work out for me, it doesn't work out for me. You just find where you're supposed to be, if that's truly where you're supposed to be. So, as I was stating, I went off on a tangent. Being a primary care provider is overwhelming, because I feel like sometimes I am constantly second guessing myself. Am I prescribing the right thing? Am I diagnosing the right thing? And I've spoke about this before, is having your differential diagnoses. And you have differential diagnoses because there are other things that this child, what they're presenting with, could be. So it's like, OMG, is it truly this? Is it truly this, or this? And in school, they trained us in my program to have 5 differential diagnoses, if there are 5 that there could be. So even if it's 2 or 3 different ones, it's like, oh my gosh, which one is this that this patient has? And like I've said time and time again, I knew I was going to be nervous being a provider, because for some patients, I am the only provider they would see. Now, a lot of the time, which is overwhelming too, the patients, they continue to come back. They come back, 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 they come back. I've seen like a 5-week-old 4 different times, and he was still 5 weeks old. And so the parents will bring them back, and so you do get chances to make sure that you made the right decision. And of course, if you didn't, you can always call and rectify the situation. But I always feared, or didn't fear, but knew that me being a primary care provider, that I would be the only provider that sometimes some of these patients would see. And so that was overwhelming for me, that thought. And I know that everyone says, if you're not nervous, then something's wrong, basically saying that it's okay to be nervous. And I've talked to a few of the providers that I work with, and one of them's been a provider for 5 years, and she's like, she still sometimes second guesses herself as well. So it's just a part of being a novice provider, being a novice in the field that you're in at that moment. And so while I was an expert, or a semi-expert as being a pediatric registered nurse or a NICU registered nurse, because I pretty much had almost 7 years of experience as a registered nurse. So I had a lot of time to perfect and know my craft and know the diagnoses that I would see. But now, once again, I'm not starting over from scratch, because obviously I'm building on the information and the knowledge that I have, but it's almost like starting from scratch as a primary care provider. And like I said, you just never know what your patients are going to come in complaining of, because even though we have a schedule and we have a chief complaint listed, and I can potentially go over those charts prior to that patient coming in, but they could say, oh, they had a cough, and they come in the next day and like, oh, well, they have a cough and this, and this. And you're like, now what now? So you have to say, okay, I'm going to address this, and this issue, and you're going to have to come back for this, and this, because we only have 15 minutes to see a patient. So there's only but so much that I could address in one appointment. So that is like, I'd be a ball of nerves sometimes. So another reason I feel like I am having a difficult time adjusting is during my clinical care experience, I did not have any primary care clinical experience. I only did my clinicals at an urgent care. So happy and thankful that I was able to get my hours at the urgent care, but I did not get any primary care experience because of the pandemic, obviously, that we're still in. And so I feel like I am not starting from square one, because like I said before, an assessment is an assessment. I know how to do a head-to-toe assessment. Granted that being a provider, you do a little bit more in-depth head-to-toe assessment, but still your head-to-toe assessment should not take any more between 5 to 10 minutes, just to be quite honest with you, because you know what you're looking for, you know what you're listening for, and you know which spots to hit. It's literally head to toe, making sure everything is checking out. And if you are, of course, having any concerns, definitely send your kids for labs or imaging, diagnostic testing, or things like that. So while that part I don't struggle with at all, it's very second nature to me, it's the diagnosing and seeing like these different complaints that parents come in that you're not really sure how to address. Sometimes that you send the patients come in with these complaints, and they ask for labs and they ask for extra things to be done, but they don't go get those things done right away. They take their time to go get it done. They wait 2, 3, and 4 weeks before they even get the things done, because what was an urgent care issue to them that moment for you is no longer urgent after they've came to see you. So that is actually very frustrating, because it's like, oh, my kid has X, Y, and Z. I need for you to do this, and this, but then you wait 2 weeks to go get the labs done. So that is definitely frustrating. And it's like, okay, do I really feel like I'm making a difference if the simple things that I ask my patients to do, they don't do? And it's not even asking my patients, because obviously they're the proxy for their children. So I have to ask the parents to make sure they're doing X, Y, Z for these patients. And sometimes they just don't do it. So a lot of the time, while a lot of the times these parents want a quick fix, they want an answer right now, when you give them the tools so that we can figure out what's wrong, they just don't go all the way through or follow all the way through what needs to be done. Now, I'm not going to say that I don't know what I'm doing, because it sounds like, girl, do you even know what you're doing? I do. There, especially right now, cough, cold, and flu season is me. Respiratory is your girl. I can diagnose what I need to diagnose during respiratory season. So there are certain diagnoses that I am obviously much more comfortable with. You guys know I'm probably a pro at this point at diagnosing ear infections. And I am probably a pro at diagnosing asthma and working up the asthma action plan, or the asthma stepwise approach ladder. There are some things that I'm very comfortable with doing, that I can do in my sleep, I can do without second guessing myself, and I can do it very, very confidently. It's just certain things that are very new to me, certain complaints that are still new to me, that makes me very, I'm not gonna say weary but there are certain things that I still like have to look at my resource books for, which that video is coming soon, which resources that I still use, because even as an advanced provider, there are still resources that you have to use, and there are still things that you have to reference sometimes, just to make sure you're practicing up to date and appropriately and current, with current guidelines. So all providers, we have to do that. We all have to reference our manual sometimes. So there are some times that I am slowed down because I have to go look in my book, because this complaint, this is what I think it is, but I want to make sure that I go in there with a great explanation for the parent as to why this is occurring, if I can. I am very thankful for my urgent care experience that I've had prior to starting in primary care, because a lot of the time we do well child exams. Of course, we do well child exams at the top of the hour and a half hour, and then in between that are sick day visits, or sick visits, of which parents usually bring their kids in for cough, fever, or just different things. The parents bring their kids in for. So some kids, they've had this chronic issue for a few weeks to months, or this issue, acute care issue, which I am very thankful for having my urgent care experience, because I can get through those acute care issues like with no problem, with so much ease. And how am I adjusting to this new work schedule? Let's talk about that. Let's talk about how your girl is not used to working 5 days a week. It's been quite some time since I've had to work 5 days a week. And I thought, because sometimes, or a lot of the times, I would pick up like 4 and 5 12-hour shifts, quite honestly. But to have to work 5 days a week, it's definitely been an adjustment. I just feel so tired, so exhausted, and I just feel like I go to work, I come home to go to sleep, to get ready to go to work again, and I repeat that process 5 times. And it's just like, oh, I am tired, but I know I have to give myself time to adjust to this new work schedule. But I'm getting a little bit more used to it. But what I can tell you is I do enjoy having my weekends off. I do enjoy having Saturday and Sunday off. I just feel like I need maybe one more day to have fully off. I need one more day to have off. I just need one more day. I do enjoy the weekends. I do enjoy knowing that I'm going to have the holiday off, not having to rotate holidays, or having to work 2 winter holidays and a summer holiday and another random holiday. I know that I will have all major holidays off, and that's really been nice, honestly, to know that I will be off those days. And for us this year, Christmas and New Year's falls on a Saturday, so I get the Friday before, so New Year's Eve and Christmas Eve off this year. So I'm really excited about definitely having both of those days off. Is this for me? Do I feel like I truly found my purpose in being a primary care nurse practitioner? And that is still to be determined. I don't know yet. I don't know yet. And that's probably disappointing. I know it was disappointing for me that I'm second guessing if this is truly for me, because I love pediatrics. I loved being a registered nurse. Wow, like I said, it was difficult. It was difficult being in a hospital setting. It was difficult dealing with, you know, the bureaucracy and the politics of being in an acute care setting and working for a hospital, and, you know, working for a big a big hospital organization. It can be a lot, but I don't know if the patients in the primary care setting or the parents in the primary care setting are truly appreciative of what we do, because a lot of the times these parents, they berate us and they second guess us, and it's like, did I go to school or did you go to school? Because I'm not really sure who is the advanced primary provider here, you or me. And I granted, you know your kid way better than I do, but I know children in general because this is what I do. I've been doing this for almost a decade, and I just feel like my experience should count for something. My knowledge and my schooling should count for something, and I should not be berated and second guess all the time. Because I already do that enough myself. I second guess myself enough, and I'm making sure I am going above and beyond, and I'm doing the reading, and I'm staying on top of the knowledge that I, you know, building on the knowledge that I have, staying current on what's out there. But I think for me right now, a lot of the bad experiences are sticking out more than the good experiences, because I do have some patients who are very appreciative of me and what I do, but it's like those ones who don't appreciate you weigh down on you the most. And it's just been a little more difficult for me to adjust to this role, more than I would like to admit. And I think that's a part of the issue, is I don't want to admit that it's been difficult, but it has been a little bit difficult for me. And it's not the diagnosing. It's just, I don't want parents to think I don't know what I'm doing, and because I'm very competent. Obviously, I passed boards and I was able to get my license and my certification, but nothing worth having is easy. And I am so thankful for the resources that I do have in my life, in the form of Dr. Smith, my mentor, the other providers that I work with, Julianne. You know, I am very appreciative of the other nurse practitioners in my life who are letting me know that I'm doing the best that I can, and that I need to give myself more time to adjust to this new role as a advanced practice provider, because it's not all going to be easy, and it's not just going to all be like it was as a registered nurse, because like I said, I was an expert. I've had years of that, and I guess at this point I don't remember this period because it's been so long. I don't remember being overwhelmed as a registered nurse. I don't remember the nervousness and the anxiety of not knowing what I was doing when I went into a patient room, you know, because I'm pretty sure when I started my first IV, and I'm pretty sure when I started my first tube feeding, and I'm pretty sure, like, you know, my first, I know I was nervous, because that's just me as a person. I am nervous about anything new in life. So it's just been so long that I don't remember that period of me adjusting to being a registered nurse. And so right now, I'm taking it day by day, slowly but surely, making sure I read my book, because I read my book all day, every day, to make sure I know what I'm doing. Obviously, this is to be continued. I will come back with another update. 6 months. I think I'm gonna do 6 months this time. I want to continue to do this. I don't want to give up and say, oh, I'm just going to go back to being a registered nurse, because at the end of the day, I'm an advanced practice registered nurse. I'm an APRN and registered nurse. So at the end of that means I am still licensed and qualified to be a registered nurse. I have my compact license at that, so I am licensed and to be a nurse in any state. Or how many states? It's like 27 states, 30 something states. Anyway, I am licensed to be a nurse in quite a few states. And so if I wanted to go back to being a travel nurse or just a registered nurse in general, I'm pretty sure that it's something I can easily do. I'm pretty sure that if I gave my old boss a call and like, hey sis, I need a job, Because one thing my mother always instilled into me is to leave on good terms, because you just never know who you're going to need and when you're going to need them. And if that is something that needs to be done, where I maybe go back to being a nurse PRN, and you know, I am thankful for this field because of the flexibility I have. I could still go back and be a registered nurse. But anyways, I do not want to end this on a sad and bad note, because while I'm not going to say struggling, I am adjusting to being a primary care provider. I am adjusting to being a nurse practitioner. There are some things that I like about it. There are some patients that I do love and that actually do love me back. And I am so thankful for the practice that I work in now, because they are been so accommodating to me and so welcoming. And they are there for me if I have any questions or if I have any concerns. So I am going to say I am thankful for where I am now, because it is a part of my journey, and it's a part of whatever is next for Janine's journey. And they are a part of my journey now. And so I'm very happy to be where I am now, continue to learn, to continue to grow in this practice that I am, practice of where I am now. So as always, thank you guys for tuning in to Janine's journey. You already know what I'm about to say. You already know what to do. Make sure you give this video a thumbs up. Make sure you leave any comments you have down below. Make sure you subscribe. And make sure you tell a friend. Woo. Something ducks behind me was saying. Woo. Anyway, I will see you guys in the next video.